From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado...
Hello, everybody, and welcome back to the Modern Practice Podcast. Excited for today's episode as we're joined by Shay, Hodzic, Senior Practice Solutions Consultant at Rectangle Health, to discuss how providers can future-proof their practice. We'll get into exactly what that means and entails here in just a minute, but before we do, Shay, thank you so much for taking the time to join the show.
Yeah, absolutely. Good morning to you, Gary. Thank you so much for having me on. I'm really excited to be a part of the podcast. I'm a big fan of yours. So
thank you. Thank you. It's the first time I'm hearing that, so I appreciate it greatly.
Of course.
Pleasure's all mine. And again, we're happy to have you here. So Shay, before we dive into what future-proofing a practice or healthcare organization looks like, I know you do a ton of volunteer work. You're involved with a few organizations. Can you talk to me about them?
Yeah, absolutely. Well, you know me too well, Gary. If I'm not working, I'm out volunteering. I spend a ton of my time and resources working with ASPCA and Keyway Center for Diversion and Reentry here locally in St. Louis.
That's awesome stuff. And how long have you been involved with them?
I've been involved with the ASPCA for the last 10 years. It's more national. So even as I moved, I was able to spend a lot of time working with them. And then the Center for Women in Transition, I've been involved for about 3 years now since COVID. So.
Wow. Well, great work. Super impressive. And I'll be sure to link to those groups in the episode description for anyone that wants to learn more or get involved. So let's get into it. In order to future-proof a practice, you've got to have a deep understanding of what's happening now at practices across the country, really. You get to talk to these dentists, doctors, optometrists, office managers, and other staff every day. What's going on? Are you still hearing about staffing shortages? Are they facing challenges in getting paid for the care they provide? Can you sort of give me a high-level overview and then we can get more in depth?
Yeah, absolutely, Gary. So I speak to a variety of practitioners all across the country every single day. And unfortunately, yes, it's 2023, 3 years post-pandemic era. Practices are still facing the challenges of being short-staffed. They're experiencing high employee turnaround rates. And on top of that, they're faced with the challenge of collecting balances owed by patients. Accounts receivables collections are at an all-time high. It's harder than ever to collect payments.
As you mentioned, it's 2023. We're so accustomed as consumers to paying online, digitally, quickly, and easily. So what are practices saying? Why is it harder to collect?
Unfortunately, a lot of practices across the country, they just don't have a payment platforms that gives patients that flexibility to pay after 5 p.m. They don't have the ability to text patients a link to pay. They're still, sending out hundreds of statements every single month, spending hundreds of dollars in doing so. And, their patients, they want to pay. They want to stay with their trusted provider, but they're just accustomed to these digitalized amenities.
Yeah, that's, to think that a paper statement, I don't think I've written a check in quite some time, honestly. So, we're, like I said, we're so accustomed to checking out online, yes. The Amazon experience, the Netflix experience, excuse me. Just shifting gears, what about maintaining compliance? I'd imagine, based on a conversation I recently had with, our resident compliance expert, Terry McDonald, that meeting compliance requirements has got to be harder because staff is spending all their time chasing down AR. Is that true?
Oh, yes, absolutely. Terry McDonald is a great colleague of mine. So I had the opportunity actually to sit in on a lot of his webinars. I've actually watched the podcast he did with you. So yeah, it's absolutely 1000% true. They're faced with turnover rates, I mean, higher than ever. It's impossible for one office manager to get their staff trained with everything that they need in order to be in compliance with HIPAA and OSHA standards within 10 days of start, than just for the employee to leave the organization a few months later. So I would say just about every single office manager that I work with wears multiple hats. They're the accountant, they're the HR, operations manager, you name it, they do it. So, this is just another major task for them to keep up with. And, Gary, they're struggling. They need an efficient mainstream way.
We've heard that so many times, the point of office managers wearing so many hats. We've seen it time and time again at trade shows as we meet with OMs. It's a constant point that's brought up on this show. So given this high turnover rate of staff, given the lack of time to focus on compliance, given the challenges in collecting payments, how does a practice get ahead of all of it? Is it possible?
We'll start with one pain point at a time. So with the staffing and turnover issue, you want to be able to have the ability to transition smoothly, right? That's not possible with 10 different system logins. There's a learning curve there. You can't properly train if all your staff is on calls, following up for appointment reminders, payment reminders, mailing statements, calling insurance companies, just etc. Take your time. That's important for future proofing. Find the right software that does as much of the operational task as possible. Learning one system is way easier than 10 any day of the week. And as far as payments, it's like you said, it's 2023. We're used to paying digitally, so make that available to your patients.
Can you go into more detail on the payments? Like, what are the options? Should practices have one or all of those options?
Sure. And the simple answer is a practice should have a system that allows them to text, store a card on file, offer financing, online, bill pay links, etc.
And again, these are all things that people are using every day in other industries.
Right. It's automated, it's smooth. I actually have a client that is based in Utah that have reduced AR simply through text to pay and the QR codes. And it's not, just the payment side. It's also reminders and scheduling too. That stuff takes time when you do it manually. If you can have an intelligent tool simply work for you to keep your schedule full, productive, and keep your practice generating revenue, but most importantly, keeping your patients healthy, why wouldn't you rely on it? Your staff can focus on really developing strong bonds and relationships with patients during their visits.
Now on to the scary one, compliance. How do you future-proof that component of the business?
I love that. So it doesn't have to be scary. And I show that to practices that I speak to. For practices not using software to manage it, you're doing 95% of the work manually. That's a lot of time and effort, but the ratio should be reversed. 5% effort and work, and let the system or solution you use, like Rectangle Health's solution, do 95% of the work for you. Imagine having that time back or that pressure off of your back.
Yeah, absolutely. And I love what you said there, reversing that ratio. That's a massive time impact massive amounts of
Yes.
effort given back to the staff that's already wearing, like you said, so many hats. That's huge.
Yeah, absolutely. Absolutely.
What's your process for a practice that comes to you and has staffing problems, high turnover, high AR, compliance worries, everything we've discussed today?
Gary, my process is I really love to spend some time with practice. Every practice is different, right? And I like to know what they're doing great in their practice. And I like to learn what their pain points are so I can structure a program that helps them meet their individual needs.
Can I drop your LinkedIn profile in the description of this episode for anyone that would, kind of sort of like to kick that conversation off with you?
Yeah, absolutely. I would love that. Love connecting with people.
Great. Thank you so much. And before we wrap up with the last question, I want to say I think we can get into the weeds much further, and I'd love to have you back real soon, because what I think happens is technology or software layering, this idea of paying for one tool that solves for one issue, but not another, then adding more on top of that. It's really important to find and identify software that does all of it, if not most, from a single sign-on. It's much more cost effective. It helps new staff and legacy staff learn quicker and really future proofs the practice.
Yeah, absolutely, Gary. I love to come back. You mentioned a second ago, but a practice has to make a software buying decision that helps today and tomorrow and a year from now. It has to be adaptive. It has to constantly be growing. Again, just a shameless plug. And that's what Rectangle Health does. But we can get into that another time.
For sure, Shay. So last question here is, this is something I've asked other guests on the show, and because you speak to practices directly every day, what is the impact of this future proofing, modernizing on the patients?
Happier patients, of course, better patient experience, easier patient experience, and seamless. It doesn't need to be a burden to go into your practitioner's office. It should be seamless. It should be pleasurable. You want more visits.
So true and amazing. Thank you for that, Shay. And thank you for taking the time to join me today.
Thank you so much for having me, Gary. It's truly been a pleasure.
Well, the pleasure's all mine, and I'm looking forward to having you on the show again in the upcoming weeks. For our listeners tuning in today, let us know how we're doing. Give us your feedback and let us know what you'd like to hear discussed on future episodes of the Modern Practice Podcast. And if you enjoyed today's show, be sure to like and subscribe as well. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.